taken anatomy courses, pain science workshops, maybe even injury specific trainings, and spent hundreds, if not thousands of dollars. But then when one of your students tells you that they have a rotator cuff injury, you still aren't really sure what you should do, what you should say. I'm Monica, and I help yoga teachers build confidence working with students who have pain and injuries. Today, I'm going to talk to you about what actually matters, what you should actually look for when you're looking for continuing education for working with injured students, why most courses don't help you feel confident, and what to look for when you want to invest your time and your money. By the end of this video, you're going to feel crystal clear about what your next step should be. First, if you're already taking trainings or workshops and you still aren't feeling ready, that's not because you didn't do enough. It's because most continuing education has a fundamental problem. Most continuing education focuses on giving you more information instead of helping you apply what you're learning and what you already know. You take a shoulder anatomy training. You learn about the rotator cuff muscles, the labrum, the bursa. You take notes. You feel excited. Then you go back to teaching, and a student says, I have shoulder bursitis, and you immediately go blank. But why is that? It's because knowing shoulder anatomy and knowing what to say to a student with shoulder bursitis are two different skills. It can kind of feel like a trap, right? You keep thinking if you just learn enough, you'll feel confident, but confidence doesn't come from accumulating information, it comes from practicing application. And most trainings don't give you that. They give you lectures, readings, diagrams, statistics, even. And yes, this is all valuable, but there's no opportunity to practice applying that information with real students in real situations. Then you end up finishing with more education, but the same kind of uncertainty. So, what should you look for in continuing education? First, application opportunities. The training should include practice where you're actually working through scenarios, developing modifications, having conversations with students, practicing with students, and getting feedback so that you're able to recognize what's wrong and what's not. This is what you want instead of just passively receiving information. For example, if you take a training that presents information and learning via a case study of a student with a hip pain and has you work through what you ask, what you modify, what language you use, and gather student feedback, that's application. Second, you want to look for frameworks over scripts because every student is different. Every injury is different. If you're memorizing what to say for a rotator cuff versus a knee injury versus a hip injury, then you're probably going to feel overwhelmed. But if you learn frameworks you can apply across situations, then you can think on your feet. The four-part communication framework that I teach, acknowledge, ask, affirm, and offer, works for any injury. You don't need a bunch of different scripts. You just always use the communication framework whenever you're talking with a student. Third, look for ongoing support, not just one-time training. Learning to work with injured students is iterative. You learn something, you try it, you have questions, you get feedback, you refine. If the education ends after a weekend training, then you're just left to figure out the next steps all alone. Fourth, you want education that addresses mindset along with technical skills. A lot of what holds teachers back isn't the lack of knowledge, it's fear, it's imposter syndrome, it's the belief that you have got to know everything before you're ready. Excellent continuing education addresses those barriers. Okay, now, if you're specifically looking for a continuing education that will help you teach students with pain and injuries, you'll want to look for specific topics to be included. There are some that make a huge difference, so let's talk about a few. First, modern pain science is foundational. Understanding that pain is a protective output, that tissue damage and pain don't always correlate, that context matters. This will change everything about how you approach modifications and how you communicate with your students. Next, you need to realize that communication skills are equally important. Learning what to say when a student tells you that they have an injury, how to ask questions that give you the information that you need, and how to use language that reduces nervous system threat. Most anatomy trainings don't teach this, but this is what teachers need the most. Third, understanding your scope of practice helps to clarify your role. Your job is to facilitate movement exploration, not diagnose or treat. When you understand that, you feel less pressure to solve their pain or their injury because that's not in your scope. Fourth, you'll need practical modification strategies for common injuries that give you tools you can use immediately. You don't need to know how to modify for every possible condition, but if you learn principles for the injuries you see the most, like low back pain, shoulder issues, knee sensitivity, hip discomfort, then you'll feel more prepared. And finally, you need less anatomy than you think. Functional anatomy that informs teaching decisions does matter, but memorizing every muscle's origin and insertion does not. Be cautious of trainings that promise that you'll be an expert after a weekend. Learning to work confidently with injured students takes time and practice. Be wary of courses focused heavily on diagnosis. That's outside your scope. Watch out for information only courses with no application component. Be skeptical of trainings claiming one approach is the answer to everything. Working with injured students requires multiple skills applied all at once. And question trainings that don't specify what you'll be able to do differently afterwards. Good education has clear, straightforward outcomes. When evaluating whether a training is worth it, ask, will this help me do something that I can't currently do, or just give me more information about things I already understand conceptually? Does it include application and practice, or is it information only? Will I have support after it ends? And is this training addressing my actual barrier, or am I hoping it will magically make me feel ready? Sometimes the best investment isn't another training. Sometimes it's practicing with what you already know or getting individualized support. If you're just starting with injuries, focus on foundational communication skills and basic modification strategies before seeking out advanced anatomy trainings. If you've been working with injuries but you feel like you're winging it, deepen your pain science understanding, and develop systematic approaches to sequencing. If you're ready for ongoing support, look for mentorship where you bring actual students and get guidance on specific situations. This is where learning accelerates because you're applying immediately and getting feedback. This is what I offer in my Teaching Students with Injuries mentorship. 6 months with 2 calls per month where we work through real situations you're encountering. Everything is taught in an application context. You can learn more at the link in the description below. Remember, the best continuing education focuses on application, not just information. It gives you frameworks, addresses mindset, and includes ongoing support. You don't need to take every training out here. Invest strategically in education that will help to move you forward. This is what I want you to take away. You already have a great amount of knowledge. What you need now is to build on that, to practice, to get feedback, and to get support in using it. A place where you can learn, practice, and refine. I have a full podcast episode on this topic called How to Find the Best Continuing Education. It goes deeper into evaluation criteria, specific topics that transform your teaching, and how to invest wisely. It's episode number 121, and I'll link it in the description. If you're ready for application-focused ongoing support, check my Teaching Students with Injuries mentorship. 6 months, real students, real-time guidance. Again, that's linked below. And finally, subscribe for more evidence-based teaching strategies. I'm so glad you're here.